Day with Dr. Alex Earle. We're here at Pure Plastic Surgery, and today we are going to talk briefly about a subject, and then, of course, I'm going to be happy to answer all of your questions, all right? But today we're going to talk about some of the signs that I did recently, well, by recently, yesterday. I put up two signs which are common knowledge within, for plastic surgeons, but not really for, people, looking for plastic surgery. So that's why I put these signs up to, create awareness about certain things. And the two signs that I put up yesterday, you all can go to my IG and you can take a look. But one of them was arm lift scars will widen, okay? And the second one was that a wound at the triple point of a breast lift is not unusual. So I'm going to go over those two things real quick because we got a lot of questions, like just an outpouring of questions regarding what I meant by these two signs, okay? All right, so starting with the arm lift. So arm lift means that's when we're actually removing skin from the arm, okay? The technical term for that is a brachioplasty. So brachioplasty, okay? So that's the technical term for an arm lift, and that means we're going to be removing excess skin for the arms. Typically, the patient that needs this is a massive weight loss patient. So someone who's lost weight, whether it's through diet and exercise, or through bariatric surgery like a gastric sleeve, or through now with these new injectables like semaglutide or Mounjaro. Okay, but the whole point is that you lose weight rapidly, you get rid of the fat, but the skin does not have a chance to bounce back, and then you're left with this very loose, kind of flappy skin, especially in this lower part of the arm. And so the only way really to get rid of that is to remove the excess skin. And unfortunately, there is no other way to do that. Like, exercise is not going to take care of excess skin. You can kill yourself at the gym, and you're going to be toned, and you're going to be bulking, you're going to be building muscle, which is great. But the skin, the loose skin, is going to remain loose. There's nothing that you can do at the gym to fix loose skin, okay? So then we have to do the brachioplasty. So if I'm kind of drawing my, my crude arm here, and then here we go. So if this is the elbow, okay, and this is the shoulder, there's a person. So typically, the scar is going to go from very near the elbow all the way to the armpit area. So you're going to see a scar that goes all the way along through there. And I like to place the scar like right along here. So from the elbow typically to the armpit area, right along this area, because I like to place it in that position because when your arm is down, you can't really see a scar from the front or the back, okay? Of course, if you lift your arm up, then that scar becomes visible. There are other surgeons out there that like to put the scar in the back. They like to put the scar in the back because then the patient doesn't see it. But of course, if you're walking and someone is looking at you from the back, they're going to see the scar in the back there. And that's why I don't like that incision in particular. Okay? I like it to be kind of hidden against your body. But it is a long scar, and that's why this surgery is reserved for those people that just have a lot of excess skin. And so the problem is that there's two issues. This is a scar in a tubular or circumferential, limb, right? So your arm is, you can think of it like a cylinder. So it's getting tension, in all directions because it's like a cylinder, okay? So as you move around and, as you're healing, as you're picking yourself up, as you're doing anything, right, you're always using your arms, right? It's very, very hard to completely immobilize the arms. And of course, you wouldn't want to do that either. You're going to make all the joints get stiff. And people need to do stuff, right? You need to work on your computer. You need to be able to drive. You need to be able to eat, okay? So for that reason, you can't really immobilize the arm. And so when you don't immobilize the arm, by definition, you're getting tension on the incision. And whenever you have tension on the incision, it's going to lead to that scar to become a bit wider, okay? So you're going to have a wider scar. So not all scars are built equally. So scars that tend to widen, well, the most common ones are the ones in the arm and the ones in the thighs. Same reason. Thigh, big cylinder, big tubular structure. You're always moving your legs, right? You're walking around. In fact, you can't be immobilized because that's going to lead to blood clots. and dangerous stuff. So you have to be up and walking, so you're moving your legs, and so you're putting tension on the thigh, and so that scar tends to widen as well, okay? So these are the reasons why these scars tend to widen. Sometimes, you know, if it's just a little bit of width, maybe like a centimeter of width, then most patients are happy with that and they don't want to touch it again. Now, in some patients, that may become even more, you know, even wider than that, more than a centimeter. And in those particular cases, some patients do want to come back and then try for a scar revision. So what is a scar revision? So when we do a scar revision, then we're basically removing all the old scar and creating a new one and hoping that it heals in a way where it's less wide, okay? Why would it be less wide the second time around? Well, typically because there's a little bit less tension, because we're not cutting off all that excess skin. We're just removing that area of the scar, and that's it, and then putting it back together again. All right, so those are all the possibilities there, and that's why I put up that sign where I just want to make the public aware, you know, PSA, public service announcement, that if you're going to get an arm lift, it's very likely that the scar will widen. All right? The second sign had to do with breasts, and particularly had to do with a breast lift in an anchor type pattern. So anchor type pattern is where the breast lift looks like this, okay? So this is the breast, right? And this is the areola and the nipple. And so this is what we call an anchor type pattern. The technical term is called a wise pattern, okay? And so when you do this type of lift, this is for the most kind of, you know, severe droopiness of the breast, right? So you guys have heard me talk about this before. The breast has certain degrees of droopiness or ptosis, and so there's grade 1, 2, and 3. So grade 3 is the most severe type of ptosis or droopiness, and when you have a grade 3 ptosis, that means that the nipple position is very low on the breast. It's actually the lowest point of the breast. It needs to be lifted quite a bit. So when you have that 3rd degree ptosis, you have to then fix it or do a breast lift with an anchor type incision, okay? Which is great. This is a very powerful technique that we have to really greatly lift up the breast and create a major change there. And it works very well for breast lifts and breast reductions. All right, all reductions come with a lift as well. But the one thing that you have to be aware of with this is that there's what we call a triple point. There's a point here where this flap comes in, this flap comes in, and then this flap comes in. So that's why we call it a triple point, okay? Or the upside down T point, right? If you extrapolate that out to here, it looks like an upside down T. So upside down T or triple point, and right there, right at that triple point, because it's the spot of the most tension, that is where it could potentially open up a little bit, okay, and create a small wound. And that's what we call the triple point wound of the breast lift, specifically of the anchor pattern breast lift, okay? Now, if you're not expecting this, then you may get scared. You may get surprised, and you may get scared. But the reason why I wanted to make this, you know, kind of a public service announcement is because, number one, it's very, very common. It probably happens anywhere between 20 to 25% of patients that are getting an anchor type pattern breast lift or breast reduction. So it's super common, okay? But number two, there's nothing to be scared about. Typically, we just treat it with some antibiotic ointments and dressing changes, and it just heals on its own. So it's really, you know, for the most part, not a big deal, okay? So just want to, you know, inform you all that it's something that may happen, but if it does, you just let your surgeon know. They'll let you know how to take care of it, and typically it's just going to heal on its own, all right? So those are the two signs that I put up yesterday talking about that. We had gotten several questions about these things. One of them was, well, do you not recommend an arm lift? No, so don't take it to that extreme. I definitely recommend an arm lift when it's needed, right? If you've undergone massive weight loss, you've lost 60 pounds, you have this huge flap of skin just kind of hanging out here, the only way to take care of it is with an arm lift. So you have to remove all that excess skin. And believe me, you're going to be a lot happier with a little bit of a widened scar in the mid-arm here than with that huge flap just flapping around in the wind all the time, okay? All right, So that's what it was all about. I know we had several questions regarding this topic, so I'm happy to answer them.
Okay. Is a little bit of fat better for a booty enhancement than a lot of sculpture?
Oh, so that's a good question, right? So the best filler, especially for the buttock and hips overall, the best filler that we can use is your own fat. I mean, I think that's hands down, okay? But of course, in order to get your own fat, we have to be able to harvest it, which typically means liposuction. So, and then of course that means like a bigger surgery, et cetera, et cetera. So if you're looking to like really reshape the buttock or add quite a significant amount of volume to the buttock or hips, then definitely I recommend liposculpture with fat transfer. That's the best way to do that and the way to have long-lasting results. Now, say for example you've done a BBL or maybe you've done 2 BBLs and you have like this one small specific spot that just bothers you a bit. All right, well in that particular case, then it's not worth doing a whole other big surgery. We can do the Sculptra. And that works well because it works like a filler similar to the fillers that we put, in the face and then the labial folds and the lips. So you can use that Sculptra and you can use it to fill out that one little spot. That's the upside. It can be done right in the clinic setting. It's basically a lunchtime procedure. You come in, you get it done, you go home. There's no downtime. Those are all upsides. The downside is that the vial itself is relatively expensive. Okay, and that it's not meant to last forever, like all fillers, right? Like the ones you put in your lips or these labial folds, etc. They're not meant to last forever. Sculptra does last a bit more than the hyaluronic acids, but typically they say it will last maybe about 1.5 years, sometimes 2 years, and then you're gonna need another round.
I'm having a tummy tuck in August. Is fat transferred to the hip dips worth getting as well?
Yeah, so I think that's something that we've been doing more and more of lately, and I think it actually works really well. When we do the tummy tuck here in Florida, we're limited as to how much fat we can remove via liposuction, which is 1 liter. But I mean, you have a liter, right? So why not use it if you want to try to fill in the hip dips a little bit, as opposed to just tossing it out. Now here's the thing, right? You want to have realistic expectations, right? It's not like a ton of fat. You have a liter max. You can divide that in half and then do 500 and 500 on either side. And that's going to create a difference. It's going to make things look nicer, but it may not create like the super, rounded, super hips you're going for. And then you may still want to do like a liposculpture BBL afterwards. But like I said, why not start building that foundation, okay? Why toss the fat when we can use it? So I think it is an option for sure. So if you guys want to do your tummy tuck and you want to fill in the hip dips at that time, that's certainly an option that we can do. So make sure you tell your coordinator so that we can discuss that.
Okay, what age can a perfectly healthy female do a tummy tuck and then lipo 360 on a very small BBL just for projection? So the age limit will be the question.
So yeah, what's the age limits? Because if you're perfectly healthy, then of course we have a range. So the age limit is anywhere from 18 to 50. So that's going to be the age limit, 18 years old to 50 years old, 50. Okay, and that is my limit, which is 50. For other procedures, of course, the age limit can be higher. Let's say, for example, you're just doing a breast procedure, and certainly for all facial procedures, the age limit is higher. But if you're doing that combination, say you do a mind makeover, and then 3 to 4 months later, you're doing your lipo 360 BBL, then 50 would be the age limit there.
Okay, my surgeon has told me he will not do lipo along with my tummy tuck. Is that normal?
So I think you got to ask specifically what he means, right? So what is normal is that most surgeons will not do like a full lipo 360 at the time of tummy tuck, okay? Because that could potentially lead to complications. Most surgeons will certainly not do lipo in that front belly area at the time of the tummy tuck, because that is the same area that we're lifting up and then stretching out and cutting off and doing all these things for the tummy tuck, and so you don't want to be doing that and lipoing that same skin, because that's going to lead to issues like poor blood flow and skin death or skin necrosis, which is not good. Okay, so having said that, though, a limited degree of liposuction at the time of tummy tuck is okay, and that's what we do here all the time. So we do our 1,000 cc's is what we're allowed to do here in Florida, and we typically do it all along the flanks and the waist, so that we can create that curvy figure at the time of the tummy tuck.
Okay, this is a very important question for you, Doug. Can you combine a tummy tuck with a natural BBL on TikTok?
All right. So that's a question that we get very, very often. And again, I don't like to combine those two procedures. All right. I rather separate them out for most importantly safety reasons, but also I think in terms of getting the best long-term results. Again, here in Florida, if you're doing a tummy tuck, you're very limited as to how much fat you can remove, which is only 1,000 cc's, which is typically not enough fat to like truly shape the body, or really do like a full-on BBL where you're putting fat into the buttocks and hips on both sides. Okay, so my recommendation then, if you really want to have the best results, is to do your tummy tuck first, and then come back 3 to 4 months later and do your liposculpture and BBL. That way you're going to have the best long-term results. The recovery is going to be easier for each one, and you're going to have less complications, or at least the rate or the risk of complications is significantly lower when you separate out the procedures.
What does it mean when you say that the arm lift scars widen?
Right, so that is what I was talking, here at the beginning of the talk today. So what I mean that they widen is that it's not just like this little tiny thin line scar, but it ends up widening it a little bit. And well, every patient's a little bit different, but typically it's probably about a centimeter in width. Okay, and like I said before, it's because it is in an area that we're constantly moving around. And if you're moving that area around all the time, then you have tension on your incision line, and whenever you have tension, that's going to cause the scar to widen, and that's what I mean by that, and it's normal, it's expected. The arm lift and the thigh lift are the ones where you most commonly will have some widening of the scar because of the location of the scar.
Will you show me where my tummy tuck scar would be before surgery?
Yeah, sure. When you come in for your pre-op, that's something that we certainly discussed, the placement of the scar. In general, I keep my scar fairly low, and I like to keep it in a kind of a nice gentle curve in a way that it's going to be easy for you to hide it, in a swimsuit or in underwear. That's really what you want. You want to have a low scar, or a scar that starts low and then kind of comes up in a nice gentle curve. That's going to be the one that's easiest to hide. I don't like the one that kind of goes straight across. I actually hate it. I don't know why anyone does that. Because there's no way to hide that in a bikini. There's like zero chance, right? All bikinis come up and you have a scar that comes out this way, you're always going to see that scar out on the sides there. That, for me, just makes no sense. So you want to keep that in that nice gentle curve so that it follows the pattern of most swimsuits.
Should I get a tummy tuck done before lipo?
Yes. So if you need both, I always recommend the tummy tuck first. Okay, that way you can get rid of all the excess skin. You can then also do the muscle tightening and the muscle repair. Okay, and that's going to make for a much better result later when you do your liposculpture or your BBL.
Is there a thing like a BBL reversal or revision?
Definitely. So that's something that's actually growing. So we're getting more and more of these types of consults from patients that had gotten a BBL, especially a few years ago when it was kind of in to do like these very large BBLs, very large buttock, very big hips, also kind of high up with like a shelf coming off the back, and what some people patients call lats up here, and it was given like this kind of wisdom tooth look. And at one point it was kind of in to do that, but obviously not today. Now we get a lot of patients that want to kind of reverse all that. We call it a reversal, but it's more like a lot of it is more like a reshaping. They want to get rid of those lats, they want to get rid of that shelf, They want to smooth things out, create more of that upside down heart shape, kind of our signature upside down heart shape, more of that Earle curve. And then of course, some patients also on top of that want just less volume, just less hips overall, less less buttock volume or projection overall. The one thing I gotta say about that, and it depends how long ago you had your BBL or where you had it, but if at that point, back then, they put the fat into the muscle, well, that's it. That fat is there forever. There's no way to reduce that. But of course, if they put the fat in the safe space, which is between the muscle and the skin, well, that fat then is accessible for liposuction, and the BBL can be reduced.
Okay. How long is needed to wait for sitting after a BBL procedure?
So my recommendation is that there's no direct sitting for 6 weeks. Okay, so no sitting directly on the buttock for 6 weeks. However, before then, there is a special pillow. It's just called the BBL pillow. And so you can use that pillow to sit, within those first 6 weeks. What that pillow is going to do is that it's going to place the pressure on the thighs, and it's going to relieve all the pressure off the backside. Okay, so in the first 6 weeks, you use the BBL pillow, and then after 6 weeks, you can start sitting directly on the buttock.
What's the recommended time to be off work after a mommy makeover?
So my makeover obviously is a bit more involved, right? It involves a tummy tuck, it involves a breast surgery. So I would say even for like an office type setting or a desk job, you're probably going to want to take off 4 weeks. 3 to 4 weeks depending on how energetic you are. But it's going to be at least 3 to 4 weeks. And then in terms of any job that requires, more like heavy lifting or strenuous activities, say for example, our police officers and our firefighters and some of our nurses as well, you're probably going to want to take off 6 weeks for that.
Okay. Will you prescribe an anti-anxiety to take the day of surgery if one is a little nervous?
So I don't typically prescribe it myself because I'm not like the one that's going to start you on these medications. But if you you've been on it before, or your primary care doctor wants to prescribe that for you, then that's actually okay. It's one of the medications that we're okay with you taking even the night before or the morning of surgery. So we're talking specifically about the benzodiazepines, such as like Xanax is an example.
Okay. Your thoughts on Vaser lipo?
I love Vaser lipo. In fact, now in 2024, I do all of my lipo cases with the Vaser, and it's part of your package here, and it's not something that you can take out basically. So everyone gets Vaser lipo. I highly recommend it. It provides many advantages. Okay, essentially what it does is that it uses ultrasound energy to knock off the fat cells, or emulsifies, the technical term, the fat cells, and so it makes the fat easier to remove. So you're able to remove more fat with less bleeding, less inflammation, and better skin retraction. So like, who wouldn't want that, right? Who wouldn't want to have more fat removed with less bleeding, less inflammation, and better skin retraction? The answer is nobody. So yes, I highly recommend using the Vaser for your liposuction.
Is shivering normal after getting a BBL?
Shivering is normal after any surgery under general anesthesia. Actually, it's not unusual at all. So it's part of it's a little bit part of the body's response to the general anesthesia, and so you can come out of the operating room with the shivers or shivering. There's nothing, it doesn't mean there's anything wrong, so you don't have to worry about that. It's something that you may just may as well expect. Something that can definitely happen. It's actually interesting. There's a medication that's typically used for pain called Demerol, which sometimes if you give that medication, it actually helps with the shivers. And that's a possibility, but again, it depends on what other medications you've got and things like that. So not everyone can get the Demerol, but some people do, and they do feel better. But the point is, don't worry so much about the shivering. Yes, it may happen. Eventually, it will go away, and you're going to be okay.
Can I take arnica and bromelain supplements before surgery? And if so, how soon?
Right. So the arnica you can take, you can certainly take before surgery, and you can actually just take it throughout. You can take it before surgery, day of surgery, after surgery. It's not a problem. So arnica you can take throughout. Bromelain, I would recommend that you don't take it before surgery. So you want to stop it a week before surgery, and then if you want to take it after surgery, you can take it 48 hours after surgery.
Okay, this is salutation. This is your sign. If you are thinking of scheduling your procedure with Dr. Earle, just do it. You're in the best hands. And former patient.
Yes. Awesome. Thank you so much for the endorsement. So yeah, everybody go to www.pureplasticsurgery.com and hit that virtual consultation button.
Okay, well, that answered the next question: how to book a consultation with you.
There you go. So there you go. Yes, please go to our website. This is the easiest, most straightforward way of doing it. You go to our website, www.pureplasticsurgery.com, and you're going to see a button there that says virtual consultation. You're going to hit on that button. You're going to answer the questions in the questionnaire, and you're going to send us your photos, and we're going to take it from there.
Okay, I got triplets 2 years
congrats.
ago.
Okay.
Can I get surgery already?
Yeah, it shouldn't be a problem, especially if you're done having kids, and I probably after triplets, you're like, yes, I am done. But yeah, if you're done having kids, then certainly it's time to kind of start putting everything back together, right? We say that plastic surgery is the only type of surgery that restores form and function, and that's what we want to do. So I'm sure having triplets, did quite a number, especially on your abdomen. It's not unusual for women to have multiples, whether it's twins or triplets or more, have a lot of weakness to the muscles of their abdominal wall and or separation of the muscles of the abdominal wall, plus the stretched out skin. So tummy tuck is something that's very, very common for women who've had multiples, so that we can go ahead and put the muscles back together again, do that muscleplication, strengthen the abdominal wall, and remove all that excess skin.
Can you have surgery with heart palpitations?
So the short answer is, can you? Yes. Now, we have to make sure that, it's okay. Not all heart palpitations are the same, right? Or caused by the same thing. So if you have totally benign, what we call benign palpitations, then that's typically okay. That means that you have no issues with your EKG or any other heart conditions, and that your cardiologist says that it's benign and that you're okay and you're good to go. Now, sometimes you have, some patients may have a palpitation due to arrhythmias, right? And so you have an arrhythmia, then you probably won't be cleared for surgery. So the point is that we have to investigate it further. We need to really look closely at your questionnaire. We got to look at your labs. We got to look at your EKG. We got to get a clearance from your cardiologist. And if all those things check out, then it's okay to move forward.
Okay, Doug, we're just getting to the last question. Can you get a second lipo 360? If so, how long do you need to wait for round 2?
All right. So the answer is yes, and it's actually not unusual. I would say that probably at least 25% of patients that have lipo 360 and or lipo 360 with BBL or fat transfer, about 25% will come back for another round. So it's actually quite, a fairly significant number. And so it's definitely possible, but you want to wait a minimum of 9 months. You want to wait at least 9 months, ideally a year, but certainly no less than 9 months. All right. Okay, everybody. Well, I think this was great. I think we answered a lot of questions today. That's, definitely looking forward to that. We explained what we talked about with the arm lifts and the triple point scar with the anchor lift in the breast. And of course, if you guys have any more questions, just send them out to us. We're happy to create a whole new hump day based on that. All right. So I look forward to seeing everyone next week on Hump Day with Dr. Alex Earle. I'll see you then. Ciao.
Okay.